Botox is probably one of my favorite things because it always works, it does a great job, and it helps to open up the face and make you look less tired, more awake, more, excited and youthful and ready to take on the world. It can be used, between the eyes, it can be used in the forehead, it can be used in the crow's feet, and then more advanced locations include the upper lip. So as I said before, the upper lip thins and rolls under, and you can actually use a small amount of Botox to prevent that upper lip from rolling under, so that makes more pink part of the upper lip show. So it makes you look like you have slightly more full lips without looking like a duck or having anything injected into your lips, so that people really love. And it also helps to decrease the vertical lines that we get around our mouth. That happens more in women. They're often called smoker's lines, and Botox is fabulous for that. We also have the corners of our mouth downturn as we get older. We lose volume in the corners of our mouth, which causes some of the downturn, so filler is good for that. But using Botox to augment that, because there's a muscle that actually pulls the corners of the mouth down, using Botox to relax that muscle helps to turn the corners of the mouth up. You can also use it in the chin. People get like a pebbliness of the chin often kind of turns up as we age, and so by using Botox to decrease the pebbliness of the chin and relax the chin helps to provide a more youthful look. And it can also be used in the neck. So the neck is kind of an up-and-coming place where people are now paying attention to, because, you look at a woman's face and her face looks good, but then you look at her neck and you're like, oh my God, how old is she? And so taking care of your neck is really important. And you can use Botox to help retain some of the skin elasticity or the tightness of the skin and prevent the horizontal wrinkles that you get in the neck. So it's a great treatment in the neck. Botox takes 2 weeks to fully bind, and what that means is, so you go and you have your injection and you're so excited. The next morning you wake up and you look in the mirror and you think, oh my God, nothing happened. Because it takes the full 2 weeks for it to completely bind, and it doesn't always bind evenly during those 2 weeks. So, I always look in the mirror and then it's like, oh my gosh, my eyebrows are uneven. Well, but it's only been a week, so I need to wait a lot longer, or a week longer, for everything to fully bind. I wish it bound completely evenly every time, but it doesn't always do that, and that's often an area of concern for patients. But once you get to the 2-week mark, I always see my patients back and we check in and we see how the Botox is doing, and almost 10 out of 10 times it's perfect and everyone's happy, and they have the look that they're wanting. So the label says that it lasts 4 months, but nobody follows the label. It really depends on how much movement you can tolerate. So if you prefer to have a more, not frozen, but a more static, less movement type of look, then you're going to come back a little sooner. If you prefer to have a little more movement, then you'll come back a little bit later. And the goal of the treatment is really the more important thing. If we're treating some really deep frown lines, we really want to be closer to that every 4 months, because we don't want the muscles to have a lot of movement again, because we don't want that skin starting to be creased so that the wrinkle continues to get worse, because we're trying to make the wrinkle go away. So by being more regular with your injections, that really allows your skin the time that it needs to recover, because, you spent 30, 40, 50 years creating these wrinkles. They're not going to be gone in 2 weeks. It usually takes a few rounds of injections to allow your skin enough time to fully recover and get rid of that wrinkle.